We want to turn now to what's happening in the medical community, and in particular, how the medical community is facing the challenge of treating African Americans for COVID-19. We have learned from the numbers that the fatality rate in that community has been higher. We're joined now by Dr. James Hildreth. He is Meharry Medical College CEO and president and infectious disease expert. He is joining us from Nashville. Dr. Hildreth, thank you so much for joining us. This is an issue that we have been highlighting consistently on the program. I guess the big question is what to do about it, because obviously this is something that bedevils the medical community, not just with regards to coronavirus, but more broadly when it comes to healthcare outcomes.
Well, thank you, and I'm happy to join you. In light of the fact that we don't have a vaccine or a drug to treat COVID-19, the best strategy for saving the lives of African Americans and anyone else for that matter is to do our best to keep the virus from infecting those populations in the first place. And that applies to all the vulnerable populations, those in nursing homes, assisted living facilities, prisons. I think you've seen that those facilities have just been ravaged by COVID-19, and the strategy has to be for us to find a way to keep the infections from happening in the first place. And that's the strategy we're trying to employ here at Meharry Medical College for the minority community here.
Doctor, it's Adam Shapiro. What are we learning, though, early in this pandemic about the way the virus attacks people? Is this an issue of densely populated, perhaps less affluent folk being more likely to be exposed? Are there other things we're learning?
Well, I've been studying viruses since 1978, and I think it's fair to say we've not encountered a virus quite like this, just because of the broad range of tissue types in our body it infects. So anyone who has a compromised immune system or their lungs are compromised in any way, they're going to have really poor outcomes. And so we do need to find something that can slow the virus down until we have a vaccine. But it's fair to say that of all the viruses that I'm aware of that I've studied or been involved with, this one is very different, just in terms of just a huge range of things that it does to the body. It shuts down the kidneys. As you've heard, it's starting to cause blood clots in young people in their 30s and 40s who are dying of strokes. It causes really severe lung disease. And it can also trigger something called a cytokine storm, in which the immune system just gets overexuberant and begins to destroy not just the virus, but the tissues around the virus. So it really is an extraordinary challenge like none we've seen before. But I'm really heartened by the fact that scientists all over the world have focused their attention on it. And so I'm confident that we're going to find some solutions in the coming months.
Dr. Hildreth, one of the potential solutions is remdesivir, the drug made by Gilead. A couple of studies out today show more promising results with regard to that drug. How do you feel about this sort of challenge of accessibility to whether it's treatments or vaccines, particularly in vulnerable communities, given even though this virus is different, as you say, from those we've seen before, certainly there have been accessibility issues with treatments for other viruses and infectious diseases we've seen in the past. How do you think we're rising to that challenge right now?
Well, I'm hoping that as a result of the pandemic and the bright light it's shown on these kinds of problems, there will be a focused national strategy to address it, because you're absolutely right. There is a problem of access to healthcare and to all kinds of services that would lower the disease burden in African American communities. My primary focus for the last 30 plus years has been HIV. And of course, there in the earliest days, African Americans would often come into care later because they didn't have access to healthcare. And the later you present with a disease, almost any disease, the less chance we have as physicians to restore your health. So access to healthcare is definitely a problem that needs to be addressed. But take, for example, COVID-19. It spreads in aerosols, it spreads on surfaces. So when people live in multi-generational households where they can't really practice social distancing just because of the crowded nature of the living conditions, the virus is going to spread more quickly. And that might be one of the reasons why in African American communities and disadvantaged communities, the virus is having not just killing more people, but the rate of spread might be higher as well. So it all comes down to a combination of all those things.
Yeah, Dr. Hildreth, Melody Hom here. When you think about our success in identifying that this is the case, how do you anticipate change actually taking effect? Because to your point, you studied similar sort of mistreatment, misperceptions around diagnosing folks with HIV, and then thinking about COVID-19. Are you hopeful that we would be prepared for perhaps the next pandemic, and that there could be equal care, and that the care could actually be catering to living conditions and a lot of the existing factors in society?
I'm hoping that as a result of the pandemic, and we are going to get through it, but I hope as a result of this, some structural changes will be made to make sure that everyone who needs access to health care can have it. But there are other factors that are confounding the effort to make the changes. For example, the Surgeon General wrote that African Americans should step up and do better in terms of promoting their own health. But when you live in a community that doesn't have access to nutritious foods, you live in a food desert, that's a challenge. If you live in a place without sidewalks or parks, it's a challenge. When you don't have equal educational opportunities, that's a challenge, because in some places, your level of attainment in education is a great predictor of your overall health. So there are some structural issues that we need to address as a nation, as a society, that will make us all healthier. And the good news is that would lower the $3.5 trillion we spend on healthcare every year. And maybe some of that could be directed to other things that we need to do as a population. So I'm hopeful, and I see there are some good signs that people are paying attention to these things. And I'm excited that this might be an occasion for real change, where healthcare becomes what it needs to be, which is something that all of us can partake in. But you probably know that healthcare only accounts for a small fraction of our overall health, maybe no more than 15%. Those other things, healthy food, good education, being able to work and have living wage to take care of your family, all those things weigh into health, as does access to healthcare. And that's what I mean by structural changes that need to happen so that all of us can be healthier as a nation.
One of the other structural changes perhaps that needs to occur is something that you are helping with there by educating the next generation of African American doctors. How are we doing on that front? How are the numbers? Because, of course, one of the things that could help is having African Americans be able to go to a physician who looks like them, who might be more responsive to their concerns.
This is also a tremendous challenge, and one that's deeply personal for me. For example, there are 200,000 dentists in the United States that are licensed to practice. Only 6,000 of them are Black. And here's an extraordinary thing to consider. Of those 6,000 dentists, Meharry Medical College on its own trained 42% of them. That's in spite of the fact that there are 65 schools of dentistry in the United States. So that paints the picture of the challenge we have when one institution could account for 4 out of 10 of all the Black dentists. The other thing that's striking to think about is when I started medical school in 1982, there were about 550 Black males who matriculated that year. If you fast forward to 2015 or 2016 or so, that number had dropped to 512, despite the fact that there were 25% more seats available. All the other demographic groups had gone up, but African American males had gone down. And that's a challenge because as the country becomes older and, with more people of color, we need more physicians, dentists, PAs, other healthcare professionals who come from the same demographic groups, because the data is very compelling that people have the best outcomes when they're being cared for by someone that they can relate to in terms of culture, ethnicity, and all of that. That is not to say that a white doctor cannot provide great health care to a Black person. That happens every day. But the data seems to suggest that the more minority providers we have, the overall health of the population will be improved by that. So we are doing all that we can at Meharry Medical College, and I know other places are as well, to make sure the pipeline is robust for minorities interested in healthcare. And I think as a result of the pandemic, more young people are getting more interested now in medicine and research, and that makes me feel very excited.
I hope so. And thank you for all the work that you're doing there, Doctor. And thank you for joining us. Dr. James Hildreth is Meharry Medical College CEO and president, and he's an expert on infectious diseases. Thank you again.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.